Hi, I'm going to speak to you today about SIDS, or Sudden Infant Death Syndrome. Sudden Infant Death Syndrome is the third leading cause of death in the United States. According to the CDC, 38 deaths out of every 100,000 live births in 2016 was a death due to SIDS. And I've recently become more impassioned about learning about SIDS due to the unexpected death of my niece at 10 weeks old, who died due to SIDS. So I have a question for you. How would you answer a new parent that asks, how do we prevent SIDS? We all know that the most important thing about preventing SIDS is to put a baby on its back to sleep. But did you know there are other things you can do to prevent it? So I'm here to tell you a little bit about that. The first thing is the bedding used. The bedding should be firm. So a nice crib mattress, which are made especially for babies to sleep on. You do not want to have any blankets or pillows. Also no stuffed animals and bumper pads. All the type of things that come in the new bedding sets that we can buy at any store for a newborn baby. It's also important to try not to share your bed with your infant, because our beds tend to be softer. We do use blankets and pillows, and all of those things have a higher risk of suffocation for the baby, since the baby is not as capable of turning their head appropriately to prevent that suffocation. Also, another thing is to try not to overheat the baby. Overheating can cause the baby to not be able to breathe due to hyperthermia. Another thing is to also use a pacifier. Pacifiers will also help to keep the baby from sucking, or keep the baby sucking, which I did find this information on mayoclinic.org, where they said that it has been found that babies who sleep with a pacifier have a lower risk to die from SIDS. The only problem is if you are doing a breastfed baby. Breastfed babies should not use a pacifier till they're at least 4 weeks old, due to the baby still getting used to being on the breast and needing that type of stimulation. Something else that is very, very important is to try not to smoke around the baby. Smoking can cause the baby's lungs to not be able to get rid of, to not be able to breathe appropriately. So smoking out, if you're a smoker, which there are a lot of people who are, I'm not saying that you should quit, but you could try smoking outside of the house so that the baby is not exposed to it. But the big thing is always remember to be able to educate your patients or the parents that you speak to. So having pamphlets which explain to the parents how they can prevent this in their own house would be a great way to educate parents to be able to take care of their babies and hopefully prevent SIDS. Thank you for listening.